Hi, my name is Kimmy Armitrout. I'm the orthopedic coordinator here at Western Arizona Regional Medical Center. The reason you're watching this video is because you decided to have your total joint replacement done here at our hospital. I would like to introduce you to some of the staff that's going to be with you and walk you through the process. Thank you very much for watching.
Hi, my name is Bethany. I work the front desk at Warmsey Hospital. When you come in for your surgery, you'll come in through the front doors. You would sign in the sign-in book, which we will have right up on the desk if I am not here. Then you would take a seat in the lobby that's located behind my desk, and then you would wait for registration to call you up to get you registered for your surgery. Once that is all said and done, you would take a seat back in the lobby and wait for the nurses to call you up to get you prepped and ready to go.
As soon as you get done registering, you'll get your bracelet and your fall risk badge. You'll come back, you'll sit in the waiting room, and then you'll await your pre-op nurse to call you.
Kimmy?
Here we go.
Hi, my name is Tara and I am a nurse in our pre-op ambulatory surgery department. I'm going to just show you how we're going to get you ready for your surgery today. So when you enter into our pre-op area, we're going to step you up on the scale and get your height and weight, and then we're going to bring you into a room just like this. You're going to get on the gurney and we're going to have you do a few things to help get you ready for the surgery. So a couple of things that you see here on the bed are things that we use to get you ready. The first thing that we do is we're going to have you get changed. After we go over your pre-op information and your medications that you take at home, we'll just confirm that you have a person here with you who's going to take you home after your procedure, and then we'll start to get you ready for the procedure. So in addition to the wash that you're going to do at home before you ever come into the hospital, when you come in for your procedure, we're going to have you do basically another bed bath, okay? And so you have these wipes that you're going to be using. These are special wipes that actually help wash your skin and get any bacteria off of your skin that we don't want transferred to the area where you're having surgery, which could increase your chances for infection. So we want to make sure that we get this done. There's some important tips that we'll give you when you come in about using these, and we just want to make sure that you decrease your risk for infection, which is what the purpose of these are. The other thing that we're going to have you do is nose in, and we will do this for you before we get you ready to go in for the procedure, but nose in is meant to help decolonize any bacteria that you have in your nose. And we all know that we touch our nose a lot. There's some studies say that you touch your nose about 4 times a minute, which increases your chances of moving any of that bacteria and touching any other area near where you might have your incision, where you could transfer MRSA or staph infection and increase your chance for infection. And so we're trying to prevent that as well. So that will be done in your pre-op area before the procedure as well. When it's time to get you changed and in the bed, we're going to have you put on this special gown. This is a warming gown. This teddy bear will go right here on your chest, and it's going to open up to the back. You're going to slide your arms in here. We'll tie this tie behind the neck, and it'll be open in the back. This has ports in it that we can plug in to the wall, and we have a warmer in every room, so we can plug it in and get you warm if you're really cold when you come in, because we do keep the pre-op areas very cold. The other thing is that we keep all of our areas pretty cold, and these warmers are in all of the areas that you're going to be in for your procedure, so we can keep your body temperature under control for the procedure during, before, and after. So that's what this gown is for. The other thing that we're going to be doing is putting TED hose on the unaffected leg. So if you're having a hip or a knee surgery on the right leg, we're going to put these TED hose, which are compression stockings, on the left side preoperatively. These are meant to help prevent blood clots, and your physician would like you to wear these, and it helps just to prevent blood clots before the procedure, during, after, and in your recovery process. So if you're having a shoulder surgery, you will be wearing these on both legs throughout the procedure. And after your surgery, you will have it put on the affected leg once all of the bandages come off after your surgery. The other thing that we'll do when you come in for the procedure is we're going to have you put on these special socks. So Kimmy told you about wearing the fall risk band, and that's what these are for as well. Anytime you have anesthesia, you will become a fall risk. especially if you have a joint replaced, because you're not going to have full motion with that leg for a little bit after the procedure until you've worked with physical therapy. And so anytime you get out of bed, we want to be sure that you are safe and that you are at a lower risk for falling. So these will help with that because they have the skids on the top and the bottom, and you'll wear these while you're here with us. We'll also have you put a bonnet over your head. This helps to keep infection out of the operating room. So you'll be wearing this over your head during the procedure to keep hair from getting anywhere in the operating room. This green bag is for your belongings. So we'll be putting all of your belongings in that bag. It'll go in a locker in our recovery room, and when you wake up, they'll be able to get your belongings right there for you. We want to make sure that you don't wear any valuables with you, no jewelry, nothing like that. All of it will have to come off during the procedure. If you're wearing dentures, anesthesia will want those to come out as well. So we have a cup in our little drawer here that we can keep them in for you. If you're wearing glasses, you can bring a glass case, or we have a special envelope that we can put them in as well to keep them from getting broken. But we will have you remove those things, hearing aids as well. We'll put those in a little cup with your name on, and they'll go in your belongings bag, and we'll make sure that they stay safe and that you get all of those back after the procedure. Other than that, when you come in this room, once we get you all changed and in the bed and ready, we're going to hook you up to our monitors, get your vital signs. We're also going to get your IV started. All of your anesthesia will go through that IV, and so all of your medications will go through that, but you will require one of those. Other than that, your physician's going to come in, anesthesia's going to come in to see you before you go in for your procedure. Anesthesia is going to come and talk to you about the possibility of a nerve block. Your surgeon is going to come in, and they're going to mark your joint or your leg, whichever side you're having your procedure on. They're going to come in and he's going to mark it for you so that the OR crew and everybody else taking care knows that the doctor has been in to see you and that they have verified where the site is that you're having the surgery to keep everything safe, and they will also confirm that with you. Your name band, we will verify that multiple times throughout your stay. We want to be sure that we have the right person having everything done. Also, if you're allergic to any medications, we'll be adding an allergy band to your bracelet as well. So we are grateful that you have chosen WormC to have your procedure today, and we are excited to see you.
After your procedure, you'll come in here to the recovery area. The nurse will stand at either side of the bed and give the oncoming nurse the report of how you are doing in surgery. We're going to monitor your vital signs, and you're going to start to wake up. One of the things I'm going to hand you is an incentive spirometer. This is going to help clear your lungs from surgery. We're going to suck on this like a straw. Okay, as soon as I got you awake, we're going to bring in the radiology team, and they're going to take a picture of the total joint that you have just completed replacing. Now I would like to introduce you to the therapy team.
Hi, my name is Rebecca. I'm a physical therapist and part of the rehab team for your joint replacement recovery. We will be seeing you in the recovery room after surgery, and we will go over your exercises for your particular joint replacement. We will also be going over your precautions at that time, and we'll be monitoring you on a vitals machine during the entire session. During this time, we will teach you how to get in and out of bed, transfer, stand, and walk. We'll walk you to the bathroom. We'll help you transfer on and off the toilet, work on standing balance, and climb up and down at least one step to help you simulate a step for home. We will walk approximately 60 feet prior to you going home, and during this time we will be monitoring you. As long as your heart rate remains within functional limits, you're not having excessive pain, you're not having symptoms such as vomiting, throwing up, excessive pain, nausea, low blood pressure, we will be clearing you to be able to go home that evening. During this time, we will go over your exercises in bed, in sitting, and in standing. We will also be going over your precautions for each individual joint recovery replacement. Once this is done, we will be returning you to Kimmy and letting her know that you have been cleared for discharge home. Thank you.
Thank you, Rebecca. As soon as you've been cleared for surgery, the PACU nurse has seen that your vital signs are stable and everything looks good. Your doctor will come over and see you one more time and discharge you home. If there's any equipment that you may need, if you need an ice machine or if you need a front wheel walker, let me know as soon as possible and we can get that delivered here today. Thank you so much.